Got Charles Moak, my new book. If your testosterone is low, you're going to get fat, and 17 other things the FDA does not want you to know about low testosterone. And one of the bias that doctors and the community has regarding testosterone is we tend to think it's just about sexuality and about erections, and it really can be further from the truth. But we do know that if a man's testosterone level goes down, he's got erectile dysfunction, might have lower sex drive. And we know that if we restore a man's testosterone to a normal level, typically sex drive goes up and erectile function gets better. Look at the drugs being used to treat erectile dysfunction, you know, Levitra, Viagra, Cialis. Most of these men are going to have some degree of low testosterone, and we're not addressing that. And when we think about it as an erectile function, we got pills that you can take that will restore erectile function, doesn't do anything for libido. The inherent issue is if your testosterone is low enough where you are having erectile dysfunction, you're putting yourself at risk for other things if you don't treat it. Number one, the big one, is obesity. You're going to put weight on. So if your testosterone is low and you're having a little erectile dysfunction or a little bit less sex drive, your weight goes up. Number two, you double your risk of a heart attack. Okay? So it's not just for erectile dysfunction. If you're having erectile dysfunction or decreased libido because your testosterone is low, your chance of a heart attack goes up double. Yet if we treat your low testosterone with testosterone replacement, not the other drugs, you drop your risk back down in half. Number three, if your testosterone is low, you increase your risk of diabetes. If your testosterone is low, you increase your risk of genitourinary problems with urination. If your testosterone is low, you have more risk of prostate cancer. And the list goes on. So testosterone replacement is not just for sexual dysfunction. It certainly works for that. And as doctors, we're prescribing these medicines to create a function, to create a plumbing problem, but the reality is, in many cases, this is a hormonal problem. It's very easy to test and they're very easy to replace. So thank you very much.